First of all, I liked a lot of what you said here. Your point that males and females and gender and sex don't differ independently. That was a good one. But my question, when you started talking about transgender or sexual reassignment surgery, you used the terms it shouldn't be indulged in. So is that a stance as to I'll stick with adults specifically. Is that a stance on gender reassignment surgery or hormone therapy for adults? Would you be against those?
Yes, absolutely, I would be. As is the doctor who pioneered the surgery, and the reason for this is that obviously people who have this condition of gender confusion have much higher rates of anxiety, of depression, of suicide, and there is no scientific evidence that any of that decreases after the surgery. And as a number of people who still practice the surgery have recently testified, there have been increasing rates of regret and trying to undo the surgery, which is very difficult. The difficulty with the transgender question is you have to ask, is this man who thinks he's a woman really a woman, or is this man who thinks he's a woman a man? It seems that the answer is clearly the latter. He is a man. Who is to benefit by indulging the delusion that he is other than he is, that he should pay $50,000 to mutilate his body with an equal chance of having depression and suicide and regret afterward? Who is to benefit from that? It seems nice. It seems, in a very shallow way, like the compassionate thing to do, because we don't want to look anybody in their eyes and tell them that they're mistaken about something, but they are, and it's not compassionate to allow people to go on in delusion and to harm themselves in the process.
So I sort of have a secondary question on that. So would you be, if, say, I don't know the specifics of the efficacy of sexual reassignment surgery and hormone therapy, but let's take for the sake of argument that you're correct on that point, that there's no significant decrease in related symptoms of anxiety or depression or whatever. Would you, if it was the other way, would you then support it? So you were sort of making two different arguments there that seem to be in contradiction.
Well, the place where my argument begins and ends is that it does nobody any good. And it is a delusion, but it does nobody any good. If one were to say it is a delusion, but it dramatically reduces rates of anxiety or depression, then I suppose, like any other experimental treatment for a psychological condition, it could be tried, it could be indulged in certain well-regulated areas. Absolutely. I mean, that's what we do in medicine. That's how we innovate in medicine to treat conditions, which we all admit are conditions, which are mental illnesses. But until that time, I see no reason to do it. I think it is political activism that is exploiting an extraordinarily small minority of troubled people, and I think it's very wicked to do it.